as I mentioned in the, I think I sent out, this morning I sent out a message just to say that we're going to continue a little bit talking about some of the economics of COVID-19. I actually have a couple problems today that actually I think fit the analysis of our current situation. And these are actually problems that have the same structure as problems that you saw previously in class. And I think even on the exam, there were a couple problems that the analytical framework of those problems actually applies, I think, to a couple different aspects of our current situation. And so I'm going to go over those. Both of those situations deal with the effects of uncertainty. If you remember the reservoir problem on the exam, I think it was number 2, where you have some reservoir that you could build. You could construct a reservoir that would act as like a source of water in the event of some drought, and there was some probability of different levels of drought. And I feel like that situation actually maps on pretty well to the problem of how much excess hospital capacity does it make sense to have in the event of a pandemic? How much does it make sense to build up in advance in order to safeguard against the possibility of a pandemic and allow yourself more ability to deal with a spike in hospital visits in the event that something like this occurs? I think that problem actually is analogous to that reservoir problem that we had seen on the exam. And then there's also the other problem on the exam, number 4, which was the option value problem. Trying to decide whether or not to develop a resource now in order to obtain some development value, some current economic value, or wait and see what people's valuation on this natural resource is in the future. There's actually, I think, an interesting analogy to our current situation with whether and how much to spend on additional testing. I think that's actually the structure of that problem, I think, is the same as the problem of waiting to see what people's preferences are before you start to develop a natural resource. So I have a couple ideas there of going over that. I'm going to use this virtual whiteboard. Is this whiteboard visible to everybody right now? I believe I shared my screen.
Yeah.
Okay, good. So that's visible. And then the other thing I'll mention is I posted the official instructions for the homework on Thursday. Last Thursday after class, I wrote that up. I posted that. That's going to be due on Friday. If I haven't already set up a online submission Dropbox, I'll do that soon. But I'm planning just to have that be an online submission that you can put in the Dropbox at any point before midnight on Friday, this Friday, April 3rd. So were those instructions clear? Are there any questions on what to do with that at all?
We don't have to assign values, right? We're just discussing, like, from the literature where each source of, uncertainty and benefit and cost lie.
That's right. Yeah. So I don't need you to specifically put hard numbers on any of the. You're welcome to if you want to. If you feel like you have a good estimate of what something is, you're free to mention that and try to pin that down. But that's not the intent of this assignment. The intent is just to sketch out a framework for thinking about the problem, identifying the rationale for policy intervention, laying out the trade-offs, considering various policies, and then identifying the relevant areas of uncertainty. Just in the same way that you're doing for your group projects, I think it would be useful in this class just to get some more practice with that structure, laying out a analytical framework and applying it to a contemporary policy issue, something that's on a lot of people's minds right now. So yeah, I scratched the previous homework assignment, and I just decided to make homework 3 be relevant to some current events and give you guys some more practice outlining the framework of a benefit cost analysis for this particular problem we have right now.
And you want us to pull from the discussions that we had, the previous discussions and those resources?
Yeah, absolutely. So part of what I wanted to do with those discussions is pull together a set of knowledge that's sort of dispersed in you guys' heads according to what you guys have been reading and watching in terms of news. And so now those are all kind of that's like a collection of information that we've all brought together. And yeah, my hope is that you could use that as if nothing else, a starting point for where to go to find some interesting and useful information on some of these issues. Okay. I posted the notes for what I had written down on this whiteboard last class on Thursday. If anyone got a chance to look at that, I actually I posted them, but I also edited them a little bit. And actually, I did put the full class on Thursday on YouTube, so that's available for you to watch again if you want to. I didn't have time to edit that one, so that one's just there and it's all in all its rawness. But if you do look at the notes that I posted since then, I made some clarifications and adjustments to the written notes. I tried to make those a little cleaner, a little bit more expansive. So that's what I'm working off of on my virtual whiteboard right here. And so if you want to, if you go to Canvas, you could download that PDF and follow along with what we talked about last time. And as I'm sliding through, as I'm going through some of these whiteboard slides, you could follow along and kind of see what else we had been talking about. I tried to make specifically some better representations of what I was talking about with how to measure benefits and costs. So I tried to clearly identify like what, so on this graph, I have this upper curve representing economic output for some given level of containment. The x-axis represents containment. The y-axis represents economic costs or benefits. In the case of the upper curve, those are economic benefits to having the economy be in some degree of openness. So openness sort of increases as you move from left to right. That's the degree of openness. As you move from right to left on that graph, you implement more containment measures. So there's high levels of economic activity and economic output at the purple dot where there's less containment or more openness. But that containment and openness entails quite a bit more costs in illness and death from the infectious disease. So the purple dot would be the economic activity that would be maintained under business as usual. The red dot represents the economic costs in terms of the illness and death. And then we could consider in the next frame, if we increase containment, so we move from sort of the right-hand side of that graph to further to the left-hand side of the graph, we would implement some degree of containment at that yellow dotted line. So we've moved containment from being business as usual, completely open, now to having some level of containment. The economy suffers from that, so the economic output reduces from the purple to the teal dot, but the cost of illness decreases as well. You go from the red dot to the blue dot. And so I think the right way to think about these costs and benefits is the economic costs being, the economic benefits being the cost of illness and death that's avoided and saved by having stricter containment. So that's the vertical distance between the red dot and the blue dot. That's what I think, that's how I'm thinking about the benefits as being the avoided illness and avoided death as a result of the containment and the value of that. And then the cost of that containment would be the vertical distance between the purple dot and the teal dot, where the teal dot represents the new level of economic activity, and the vertical distance represents the difference between the business as usual amount of economic activity and the new containment regime. So is that clear? Were there any questions about that concept that I had introduced last class, but now I have a little bit better visual representations of it?
That makes a lot more sense now. Thank you.
Okay. Yep, so that's, I just have, yeah, some descriptions of what those curves are. You can follow along with that on the PDF. I believe that's currently available on Canvas. Okay. So we went over last time, we went over, you know, it's just some characteristics of the infectious disease itself and its spread. So we talked about this effective reproductive number, RE, which depends on the duration of the infection, how long it is that after people contract the virus, how long it is that they have the ability to infect others. That's sort of a virological characteristic of the disease. We have things like the contact rate, which affects the amount of spread, and also the transmissibility, which affects the amount of spread. How the symptoms of the disease itself actually lead to the spread of the disease. How much the disease causes you to maybe sneeze or cough, which projects you know, droplets of water into the air, which have the virus in it, and then other people can get infected by that. Different diseases would have different degrees to which there's transmission either through the air or through those droplets of water that people cough out or sneeze out. So those are sort of the transmissibility in particular is a function of the disease characteristics itself, and the characteristics of the virus and the symptoms that it causes. And the contact rate, that's sort of that's really the policy lever that we're thinking about. When we're thinking about containment, that's what we're trying to affect by policy when we are implementing orders to shelter in place, for example. That's something that we're hoping will affect the contact rate. And that's something that in turn we hope will affect the effective reproductive number of the disease, the amount of spread that's going on. So those are sort of fundamental to these ideas of uncertainty. We went over some of these benefits, or sorry, went over some of these costs of containment. I think we may come back to these a little bit today, but I just have these listed here as a reminder from last time. No Milwaukee Bucks. We talked a little bit about how the mitigation and the government policy response, the benefits of that are going to come in terms of the reductions to the incomes of individual people that are affected. You know, so that's going to, the government stimulus package or a government aid package is going to affect or sort of buffer the cost of containment by providing a little bit of a cushion against the lost income. That would be what you could think of as a benefit of a government policy response. I also mentioned how it could also mitigate effects on inequality if there's particular groups of people, you know, retail workers, for example, which would be particularly hard hit, at least those that are outside of the grocery sector. Retail workers that are particularly hard hit that by this disease would be a particularly affected population, which a government policy measure like just like a basic stimulus package or a universal basic income type measure, that would help mitigate the effects of the disease on inequality. And then the cost of that, those resources, that the government spends on those affected parties would have to come from somewhere. So it's either going to come from future taxpayers, where taxes would be raised in the future, or those costs would come from people that would be benefiting from government programs in the future, but those government programs have to be cut because of tighter budget constraints, since they spent some of that money today. And so those reduced, the reduced amount of those future benefits, and the people that are no longer receiving those future benefits would be paying some of the costs of those mitigation and relief efforts that the government puts in place today. We talked about how you can use some of these cost of illness figures to think about how to generate that lower curve on the benefit cost curve. So if you remember, I think it was the lower black curve in this benefit cost curve graph here. The lower curve represents the relationship between the total cost of COVID-19 and the strictness of the containment measures, and you can think about that total cost curve being generated in some sense by this cost of illness type of framework that was calculated for the norovirus. That was the table that I had listed here, where these are the sorts of expenses that are incurred as a result of having more hospital visits, more hospitalizations, more doctor visits, even if you're not hospitalized, and then more fatalities. Those all come along with the cost of illness, and so those would be benefits of containment policies, insofar as the containment policies would cause you to be able to avoid those costs of illness. Okay, and then actually, this is sort of, I didn't get to this point at the end of last class, but these costs of illness, those are going to be good approximations maybe for what the benefits of containment would be, but they're going to leave out a couple of important factors. One of those would be the measures and expenses that you incur to avoid illness in the first place. So just any extra expenditures on masks or anything like that, which help you avoid illness. And then also just the pain and suffering if you do get sick, even if you don't visit the hospital, you wouldn't technically incur any cost of illness as it would be measured in that table. But of course, that's undesirable from a human perspective, and so you undergo some discomfort. And even if you don't get the virus, you have to deal with the possibility that you might, and that could cause anxiety or dread. And you might be willing to pay something to avoid that anxiety or dread, and that would be something that's not measured in that cost of illness table, but which would, from a human standpoint, it would matter in terms of the impacts of the disease. All right, so I have kind of a compilation of, I guess before I move on, are there any questions about any of, I sort of went over that pretty quickly right now, but we covered most of that stuff last time. Are there any questions about any of the material that were on the slides here that I just went over? As always, you're free to put questions in the chat if that's more if that's easier for you. So I'll be keeping an eye on the chat. I get a little notification when there's a question in the chat. So continue to avail yourself of that option. So let's get to what I want to be the main point of this lecture, which is dealing with the uncertainties of this problem. So this is going to be the uncertainties. And again, I took some of the posts that you guys had put online in response to my prompt for on the discussion board on Canvas. And I sort of just put them into bins according to different categories of uncertainties that I think are really important. So the first one, the first category, these would involve just the characteristics of the virus itself. So virological so this would go back to the slide we talked about, the things that affect the reproductive number. You know, the things in the characteristics of the virus that matter for transmissibility are, you know, the duration of infectiousness, how long you are infectious after you contract the disease, the degree of transmissibility, so those are just characteristics of the virus itself that we wish that we knew more about. If we knew more about these things, this would give us a lot of guidance as to how long a policy like shelter in place or maintain the closure of non-essential businesses. If we knew more about exactly what these parameters were, how long people are infectious and how transmissible of a disease this is, that would go a long way to helping us figure out what the best response is. And so those two matter. And then also I'll put here, you know, the mortality rate, the actual effect of the disease on the human body. That matters a lot for what to do in response to the disease. If the mortality rate is extremely high, then of course it makes perfect sense to lock down as much of the economy as you can in order to prevent something like a worst case outcome like that. If the mortality rate, you know, is pretty low, then less extreme measures would be desirable for locking down the economy. So that parameter matters. What the mortality rate is matters a lot for optimal policy going forward. So that's the first bin of measures that I think are important. Virological characteristics. Second, so things like the state of the state of infection right now. So things like the number of existing cases, and where they are, where the existing cases are would matter a lot, and that's something that we don't have a good handle on right now. We know there's some places that are definitely seeing large degrees of hospitalization and deaths from the disease, and that's very visceral. But there could be other places, other communities where the virus is sort of latent, but it's not sort of rearing its ugly head at the moment. but it could soon, based on the fact that there's a large number of people infected at the moment. This is kind of related, but where are we on the curve right now, on the epidemic curve? Have we already peaked? Where is the peak? Is the peak coming soon and we're just about to go over the peak, or is it the case maybe that the measures we're doing right now to shelter in place, is it the case that those are preventing illnesses right now, but once we come out of our houses, then infections start to increase rapidly, and then we actually get a peak after that when we come out? Like that's a really key area of uncertainty that we just don't know too much about right now. So those broadly consist of you can think of this as the state of the state of infection. How much, where are people being infected? To what degree are people being infected in certain communities? What's the rate of current infection? How many new cases are being generated every day? Those are things that relate to the state of infection, and also the rate of change of the infection. Those are very important parameters, which would be helpful to know for designing an optimal policy response. The third category, these are economic impacts. So what's going to be the effect of dislocation or interruption? The fact that you have businesses shutting down, maybe people being laid off. Those are going to have effects, on current productivity. But if there's like transitional effects where laying people off now or having supply chains be interrupted now as a result of the slowdown in economic activity, if that causes additional friction that makes it harder for the economy to start up again once we come out of our houses, then that could have a long run impact. So these things like dislocation and unemployment, layoffs, those are things that require people to then go back onto the job market and try to find a job again. Those things make it really difficult, and they could have long run effects. There's effects on global trade. How much is trade going to be affected? This was something that was brought up in the discussion. How will small businesses respond to the current situation? Will they respond with layoffs, or will they be able to hold out and weather with this short run period? Will they be able to just maintain employees in order to look ahead to the next couple months when they can look ahead to being able to reopen? How are they going to respond in the short run to what's going on? That's an important economic parameter which we don't know about. Max had brought up how fast will the bounce back be? Is there going to be is there a reduction in spending right now which will eventually see a rebound in the future as a result of all this pent up consumption, which we're not able to go out and spend now, but maybe that will lead to an increase in maybe the third quarter of the year, after we're able to leave our homes and go out and shop and spend, what's going to be the the rebound? Will there be a rebound, and how big will the rebound be? Okay, and then the last, I mean, there's more, but I think the last sort of big category that I identified based on the discussion was the effect of, and this is related to the economic impacts, but it has to do specifically with the government policy response. So if the government decides to spend a bunch of money, if it enacts a stimulus package, and throws out money into the economy, the economic uncertainty there is what's going to be the effect of the stimulus on people's actual spending behavior. Are people going to just merely be saving that money in order to hedge against future uncertainty and sort of use it as a safety net for themselves, as an insurance policy for themselves against the future, maybe long-run economic impacts that we'll have to undergo, or will the stimulus actually sort of lubricate markets? People will spend the money, so businesses will be more confident to start back up again, and trade will trade within the country. Transactions will pick up again at the same rate as they did before, as a result of people now having more money in their pocket. This is a big question mark in fiscal policy, is what's the actual impact of an injection of money into the economy, or an injection of money into people's bank accounts. What is that going to do for economic activity as a whole? Is that enough to sort of jumpstart the car and get economic conditions back to normal? That's a big it's a big question mark, because it depends on human psychology. It depends on how much anxiety and fear people have. That may, if they are afraid or fearful, they might decide to save the money and not spend it now, but use it as a hedge against future uncertainty. Or will they be so tired of being cooped up in their houses that they'll want to to enjoy that money and spend it, and actually go out and go into the market and buy things, buy goods and services. So yeah, there's a question in the chat. Yeah, absolutely. So the question in the chat was, if they if the government enacts a stimulus package and people spend the money, wouldn't the benefits of that money just go to the essential businesses that are able to remain open? Yeah. So if it's the case that only certain essential businesses are able to remain open under an executive order, say, then you could quite easily predict that there's not going to be much economic spillover. There wouldn't be much extra benefit in the economy of people going out spending the money. There's only be a small subset of sectors that would be able to stay open and sell goods and services to people who spend that money. So in that case, yeah, if you have a stimulus along with a mandate to keep the economy closed, that's not going to be very effective. The idea behind a stimulus is that there's sort of a multiplier effect, that the money that people receive gets spent. That increases the incomes of the business owners themselves, who then have more money in their pocket to then go out and spend, and sort of it's a dynamic process that reinforces itself. And that's definitely going to depend on the degree of openness of the economy as a whole. If the economy remains closed, that ability to stimulate and have a multiplier effect is going to be limited. Whereas if the economy is able to open up completely, then it's much more likely that that stimulus would have a spillover effect, and people who own businesses would have their incomes increase. They in turn would feel more comfortable to spend money in consumption. Then that would increase other people's income, who on down the line, those people would have their incomes increased as a result of that increased spending. And you'd see perhaps a greater than a situation where the effects are larger than just the stimulus package, the initial size of the stimulus package to begin with. That's the idea of a multiplier, that it would produce effects that exceed just the dollar value of the stimulus itself because of the effects on behavior. Yeah, I mean, another question in the chat: if they just pass a stimulus package, but maintain current restrictions. I mean, the rationale behind a stimulus package is what I just described, that it causes people to spend more, and then those people whose incomes increase, the businesses' incomes increase as a result of that spending, they in turn spend more, and so that's the idea there. I don't know if there's ways to keep the economy open on a limited basis through more extensive testing. Having more extensive testing of individuals in order to determine who's actually contracted the virus, who hasn't, and allowing people to go back into society on the basis of whether they're able to pass the test. That would be something that would help make the stimulus more likely. I don't know the extent to which it seems to me that the stimulus would be limited in effectiveness to the extent to which containment measures are still in place. If businesses are still ordered to remain closed, that would seem to be something that would certainly restrict the effectiveness of the stimulus. I don't know exactly how much it would restrict the effectiveness of the stimulus, but the idea behind a stimulus is that it increases spending and has a multiplier effect as more people transact with each other. But if there's restrictions on those transactions, it's not clear that there would be too much extra effect. You wouldn't recommend the stimulus on the basis of jumpstarting the economy. You might still recommend it on the basis of helping low-income workers who are particularly affected, and that would be seen as more of a way to mitigate inequality or mitigate harm. And so it could be justified on that basis. It could be justified on the basis of this is a social safety net policy. But I think the multiplier effect would be dampened in a regime where there's restrictions on the opening of markets. So I hope that addresses, in some sense, addresses what you were asking there in the chat. I'll just pause there for a second to see if there are any further questions on anything I just discussed there. Give maybe a 15-second pause. This is where I would typically look out into the class and try to gauge how much understanding there is, and I'm limited in how much I can do that right now, but I'll just try to pause and see what's going on. All right. All right. I just want to make one further point on this uncertainty. The policy uncertainty. So the uncertainty that's going to affect what to do in the event of this crisis. That kind of uncertainty stems from these sources of uncertainty. The things that the characteristics of the virus. Oops. The characteristics of the virus, that's an important area of uncertainty. The number of the state of the virus itself and the current rate of change of the virus, those things are parameters that we would like to know about. Those are things we would like to know about. What the economic impacts are, that's going to affect what the costs are of containment measures. How much, to what extent is the economy able to remain open? How much are people able to adapt and switch to online transactions? To what extent are certain activities like education going to be interrupted by the shelter-in-place orders? Those are uncertain. The precise ways that people can cope with those and adapt to those, that's uncertain. The way that small businesses will respond, whether they're going to lay people off immediately or maybe be able to hold out for a couple weeks before they do that, that's uncertain. The extent to which they're able to do that, and then thinking about policy responses, there's uncertainty about the effects of those policies. Now, the duration of the quarantine. This was something that came up a lot in the discussion. So the duration of the quarantine. This is something that's uncertain from our perspective. From someone sitting at home, teaching a class on Zoom, I'm uncertain about the duration of the quarantine. You guys are uncertain about the duration of the quarantine. From a policy perspective, though, this is actually a choice variable. So if we're trying to evaluate the benefits and costs of containing the spread of COVID-19, those benefits and costs, we're going to realize those benefits and costs as a result of how much containment that we choose, how much of a quarantine or how long of a quarantine we choose. So this is actually, I want to clarify that this duration of the quarantine is a policy lever. This is something that you would choose as a result of gathering data on the benefits and costs and gathering data on the state of the virus itself, the mortality rate of the virus, the extent of the spread, the expected effects on economic activity. Those parameters are going to affect how much it makes sense to maintain a quarantine over time. So that's actually, I said policy level, that's actually policy lever, or a policy choice. We have control over that, or at least, as a society, the evaluation of the benefits and costs, the evaluation of the uncertainty, those are going to be things that determine how long we think is actually optimal to be in a quarantine or to maintain a shelter-in-place order. So I just want to distinguish from our perspective. Of course, the extent to which the quarantine will be maintained is an uncertainty, but from from the perspective of someone doing a benefit cost analysis, that's actually not a a place of uncertainty, that's actually a policy variable. That's an alternative that you're evaluating. You're trying to evaluate whether to quarantine and how long to quarantine as a result of the other parameters of the problem, which themselves are uncertain. So the uncertainty, it produces uncertainty about what the optimal level of the quarantine will be, but ultimately that's a choice by policymakers. That's not itself a source of uncertainty. It's uncertain what the correct level is, but that uncertainty stems from underlying uncertainty about virological characteristics and effects on the economy, effects of effectiveness of containment measures themselves. Those are things that themselves are uncertain, which affect the uncertainty of how effective a quarantine will be. But at the end of the day, the duration of the quarantine and the extent of containment measures is something that we're evaluating, and that becomes itself a policy lever. That's a choice that we would make based on our evaluation of the other parameters of the problem. So I just wanted to make that distinction in this discussion of uncertainty. What I want to do now, I want to actually go over a key decision-making framework, which results from one of the key parameters that I think is perhaps the most important right now, and that's what the mortality rate of the disease is. I think this is a key uncertain parameter. To figure this out, we want to know what the number of deaths are relative to the number of cases. This is the case fatality rate. The number of deaths is something that we can actually, we can get that number pretty easily. That's very tangible, very visceral, very countable. In the case of the number of cases, in the case of the denominator, we have people who test positive for the virus, who test positive for COVID. We also have people who had the virus and recovered. And these would be people who would not test positive, but they would have antibodies to the virus. And so you'd have to do a separate kind of test. You would not be testing directly for the virus. You'd be testing for the proteins that your body produces in order to fight off the virus, which would be still present in your body after you had the virus and recovered. In some cases, if the case was very light, you may have had the virus and you may have had what felt like maybe just a cold, and maybe you didn't even know that you had coronavirus in particular, and so you could only figure that out if you had a test to find out how many people had actually had the virus and then recovered. This is a key policy choice of whether or not to first of all do testing on to see to what extent the population as a whole is contracting the virus. That's important. But to get a good sense of this denominator of how many cases there have been to date, you could figure out how many people overall who have tested positive. Those would include people that didn't even maybe visit the hospital. Maybe they just stayed home and got better on their own without any hospitalization. So you'd of course want to test, to register that they were indeed sick with COVID-19. But you'd also want to figure out how many people have maybe had the virus and then recovered, because those would be also in the denominator of the number of cases, overall number of cases, which the death rate, the mortality rate, the probability that you die conditional on getting COVID-19, you'd want to know the number of deaths over the total number of people that have contracted COVID-19, not just those who are testing positive now, but maybe those who would have tested positive earlier, but now would not be testing positive because they don't have the virus in their body, they just have antibodies to the virus. So you might think about a testing regime to figure out how many people had the virus and now have antibodies to the virus. That's going to help us, pin down the mortality rate. So let's think about a decision tree here. A decision tree just under some some degree of uncertainty. We have maybe two policy choices. One is shelter in place. Two is just to conduct business as usual. We have a high mortality rate in the case of a, there's some probability that the mortality rate is very high. There's also some probability that it's not as high as we think. And so each of these contingencies, a high mortality rate versus a low mortality rate, that's going to affect what the payoffs are to a shelter-in-place policy. To simplify matters, I'm gonna just normalize this to the business as usual scenario. I'm just gonna make that the baseline, and it doesn't really matter what number I put there. That's just gonna be the baseline net benefits under a business as usual. I'm gonna just normalize that to 0. And just as before in my discussion of benefits and costs at the very top of this lecture, and also on Thursday's lecture, I'm gonna measure benefits and costs relative to this business as usual. So I'm gonna make that the baseline, and benefits and costs are gonna be measured relative to that. So in the event of a high mortality rate, the benefits of a shelter in place are gonna be very high. I'm gonna say this is 9 trillion. And I sort of got that number by just imagining, 1 million people dying under COVID-19 without shelter in place, and then considering that those people would survive under a containment policy, and then just attributing just a common value of statistical life to that of $9 million per life saved. So $9 million times 1 million lives would come to about 9 trillion. So that would be the benefits to shelter in place under a high mortality rate scenario. The costs, let's say the economy contracts by 1/3. Currently, our US GDP is about 21 trillion. So let's say we lose about $7 trillion of GDP. So the cost in that case would be about 7 trillion. There would be a net positive of about 2 trillion there of a shelter in place. But let's say there's also a probability that the mortality rate actually isn't as high, and maybe there's still a lot of sickness and death, but it's not as much as we thought. And so maybe the costs in the business as usual are only 5 trillion. And so the benefits of a shelter in place or of a containment policy. Let's say those are 5 trillion. And then we'll just confine the degree of uncertainty to the cost side for now. Let's say that those costs are still 7 trillion. The economic impacts of shelter in place are going to be a 1/3 contraction of the economy. So in that case, there's sort of a net cost of shelter in place in the event that the mortality rate isn't as high as we think. This isn't a recommendation of any of these policies. This is just a hypothetical framework for thinking about what goes on in a scenario like this.
What does the bottom part stand for, BAU?
That's business as usual. That's just a baseline of if we were to carry on, no containment measures, no shelter in place, no closing non-essential businesses or universities. That's what the baseline would be.
Okay, thank you.
Yep. All right. So let's get to some analysis of testing. Then I'm going to try to see if I can do this in the time remaining. So let's say the question is whether to go forward with testing to figure out what the mortality rate actually is. We could, in that event, we could test and expend the resources required to test, or not. And in the event that we choose not, we would just be in exactly the same scenario as we just described up here, where we would just be making the decision based on our expectations of the relative payoffs of sheltering in place versus business as usual. We would just be sort of making a shot in the dark, making our best guess as to which one of these policies is correct, based on our uncertainty about whether the mortality rate is actually high or low. Just to simplify matters, notice there's a 9, in the example I have here, there's a $9 trillion net benefit of sheltering in place in the event of a high mortality rate. There's a negative 2 trillion cost, or there's a 2 trillion cost of sheltering in place in the event of a actual low mortality rate, which we're not sure, whether it's high or low. So there's negative 2 trillion or there's 2 trillion. I'm just going to think about whether these, the case where maybe there's a 50-50 chance that the mortality rate is high or low. There's equal probabilities that these are high or low. So in expectation, we have some chance of benefiting by 2 trillion, by having net benefits of 2 trillion, and there's a 50% chance of having net losses of 2 trillion. And so there's maybe some expected value of not having the information. There's some expected value of basically the same as the business as usual. It would be just a straight up canceling out of the benefits and costs. There's some probability you win a big payoff. There's some probability you lose a big payoff. Just for convenience, I'm just gonna pin that to 0 because it'll be the relative amounts that actually matter at the end of the day when we're making this comparison. So this is gonna be a testing regime where we find out early, before we make the decision, whether or not the actual mortality rate is high or low. So in this case, we test first, figure out whether it's high or low, and then we're able to make our decision after we know whether or not the mortality rate is high or low. So in the event that we figure out it's high, we have a shelter policy. In which case we get 2 trillion. We have $2 trillion benefit. So yeah, so the decisions here. Sorry, I'm just making sure I have these numbers right here. The benefits to under a high scenario are $2 trillion. Business as usual. That was the baseline case. That would be $0. So that's the case. If we choose business as usual, that's the baseline that I'm measuring the shelter-in-place policy relative to. So that would be a payoff of 0. Shelter-in-place would give you $2 trillion in the high contingency scenario. Now, if under a low mortality rate scenario, the shelter policy, that would have a negative $2 trillion. But BAU would actually have a better payoff than shelter in the low mortality rate contingency. So in this case, we do the testing, we figure out whether it's high or low, and then we adapt our decision according to the results of that test. If we get a test that comes back with information that tells us the mortality rate is high, we find out shelter in place is the policy we want. If we get a test back that tells us that the mortality rate is actually low, we do not shelter in place. We do business as usual, and we get the 0 payoff associated with that. So overall, if we think about these probabilities, there's a P probability of a high mortality rate, a 1 minus P probability of a low mortality rate. The payoff to testing, expected payoff to testing is P times 2 trillion. That's the probability that we find a high mortality rate and can adapt and do shelter in place. That's the $2 trillion benefits of that. Then there's a 1 minus P probability that we find out the mortality rate is low. Once we figure that out, we just conduct business as usual, and the payoff associated with that is 0. And then the expected payoff for no testing would be a probability of P that let's just say in this scenario we do shelter in place no matter what happens. We just we enact that policy. We put out orders to stay in your homes, close non-essential businesses. There's a P probability that turns out to have a big payoff. We get 2 trill. But there's also some probability that ends up having more costs than benefits, in which case we have negative 2 trillion. So if we make these probabilities equal to 50-50, if P is equal to 0.5, then the payoff to testing is actually that's 0. These 2 terms on the bottom, these cancel out in expectation. But what testing allows us to do, so if we test, we can adapt our policy to the right scenario. We can continue and maintain shelter in place in the event that the mortality rate is high and save a lot of lives in doing so. But we're flexible in the sense that if we find out, and we do the testing, and we find out that the probability or the mortality rate is low, we can actually just at that point continue business as usual and not lose the 2 trillion worth of net benefits or not incur those 2 trillion of net costs as a result of enacting business as usual in the event that there's a very low mortality rate. So this, if you do the subtraction, if you subtract, this top part, you take the expected value or its expected payoff to testing, and you subtract the expected payoff to not testing, you'll get, if you work out the math, you'll get a payoff to testing that's 1 minus the probability times the basically times the money that you save if you're able to do business as usual in the event that you know for sure that the mortality rate is not high. So I'm not saying that the payoff to testing is as large as this. If you think about, I'm not saying it's $1 trillion, but this 2 trillion is a stand-in for that's the benefit of being able to do business as usual. To maintain if mortality rate is actually low. So this has the same structure as the problem we looked at in the wilderness preservation. We looked at a couple different ways. On the exam, it was the preservation of the wilderness had the possibility of having a big payoff because people's demand and value for recreation or visiting national parks would go up in the future. And so we waited for development. We found out whether or not there was high demand for recreation in the future, and then we made our development decision based on that. We were able to adapt our development decision based on that. The same principle would apply here with this testing problem of if we do the testing, we're able to then enact a policy that's smarter and more flexible according to what the situation calls for. If we do the testing and we find out the situation is actually really extremely dire, the mortality rate's high, we can then be confident that shelter in place is the right policy. If we do the testing, we find out the actual mortality rate is very small for this disease, then we're able to maybe lay off some of the containment policies, keep the economy more open, and not have to experience the potentially large economic contraction that we would ordinarily have to undergo if we overreact to the situation. So that's, again, I put some loose estimates on some of these benefits and costs. These were just some loose estimates on the number of lives saved under shelter in place for a high mortality rate, the numbers of lives saved for shelter in place under a low mortality rate. I kept the economic uncertainty about that constant. So there was the only uncertainty in the benefits, not the costs. But this is kind of a framework for thinking about a policy decision like, should we go forward with testing? You should go forward with testing if the expected payoff of the benefits you get as a result of learning that new information allow you to adapt your decision and gain a whole lot more relative to what you would gain on average if you were just shooting from the hip and trying to make decisions in the dark. So that's kind of I think an interesting application of some of what we've been talking about in class so far with option value. And I think that framework actually maps on pretty nicely to some of the problems we're looking at right now about, whether to try to incur some costs now to gain some more information. It would be very expensive to do these tests. It would be very expensive to test for these antibodies to figure out who has antibodies. and who already has contracted the virus and has already recovered. It would be very expensive to do that, but something like that would let you tailor your next decision about whether or not to open up the economy, or maybe you find out that, okay, things are actually pretty dire. It's going to cost us a lot to maintain shelter in place for a few more weeks or another month or month and a half. It's going to cost us a lot, but we know that the benefits are high because we know that this disease, in fact, does have a high mortality rate. Whereas right now we're uncertain about the actual mortality rate because we don't know what the denominator is in this case fatality rate expression. So that's kind of just I think is a pretty interesting application of what we've been talking about in class to our current situation, and I tried to map that framework onto the existing regime of uncertainty and benefits and costs that we're currently undergoing. We're at time right now. I went a little bit over time, but are there any questions about what I just covered here?
No, thank you.
Okay, thanks, Michael.
Have a good one.
Yeah, you too, Michael. I'm happy to stick around and chat more about this if you want to. Can't see anybody, but I'm here.
Thank you. Have a good day.
Okay, thanks, Sienna.
Thanks. Bye-bye.
Bye, Ray.